Well, once again, welcome everybody. Welcome to the April 2024 Connect-OC Coalition meeting. I'm David Pattison. I'm the project coordinator for Connect-OC with Partners for Wellness. Partners for Wellness is the umbrella organization, and Connect-OC is a program of Partners for Wellness in partnership with the Orange County Healthcare Agency. And so we're happy to have you all with us. I'll take a little time to introduce the team, the Connect-OC team, and then we're going to pass it off this week. I'm excited, not to take a break, but excited to hand the meeting over to Mr. T with Advanced OC. He's going to lead us through the topic today, the panel. Our subject is Black mental health in Orange County, and we've got a really great panel of folks speaking to that today, and Mr. T is going to lead that. So I'll pass it on to him in just a bit, but for now, I already told you who I am. I'll pass it on to Crystal.
Good morning, everyone. Thank you for being here. And my name is Crystal Bleischer. I'm the program director with Partners for Wellness and specifically overseeing our Connect-OC project.
That's Sarah.
Hi, good morning. I'm Sarah Chalice. I'm one of the health educators on the Connect-OC Partners for Wellness team. And I'll pass it to Vivi.
Good morning, everyone. Thanks for being here. I'm also one of the health educators on the team, and my name is Vivi Vu. Pass it to Camila.
Hello, good morning. My name is Camila Aro, and I'm the intern of the health educator at Connect-OC.
So that's the team. So we'll do things a little bit differently than we normally do this morning in a couple of other ways. One is, normally we have a set amount of time for partner updates at the end. We definitely want to know about what you all are doing, but we wanted to give a little bit more space to this panel discussion today. And so feel free to place any flyers or anything like that you might have coming up in the chat. Also encourage you to email them to me. I'll put my email in the chat in just a moment. And then we'll put them up on our website and do our best to send them out if we have the data, the space, to send them out with the summary email in about a week or so. And then likewise, normally we have some time to update you on what's going on with Connect-OC. I'll just say really quickly, not a whole lot other than we're just as busy as everybody else for April and May for Mental Health Awareness Month and the preliminaries to that. But anything else we'll send through the email as well. So without further ado, unless team I'm missing anything else, we'll pass it on to Mr. T.
Thank you, David, and good morning, everyone. I just first off want to thank Partners for Wellness and the Connect-OC Coalition, and David for just inviting us today. Thanks everyone for joining us to have this discussion about mental health in the Black community in Orange County. There's been a lot of work, and you'll kind of hear from, the panelists today about, what's been going on. But this includes the challenges, the resilience, and the pathways to healing within our community. So through our open discussion and this dialogue today, we hope to foster an understanding and help you understand how you can support the efforts and make actionable changes for the well-being of all Blacks. So with that, I would like to actually introduce, the panelists, but I'll just first introduce myself, Mr. T with Advanced OC. I'm one of the directors and have the privilege and honor to lead a project called Main Expressions, which I'll share more about with you later. But I'll first like to introduce one of our panelists, and we have the UCI Black Psychology Student Association with us, and one of the leaders, the vice president of the association, Adaeze, is here with us. So I'd like to introduce her, and she can, invite others from the group to introduce themselves.
Hello, thank you for having me here today. My name is Adaeze. Currently, I'm a psychology major, third year at University of California, Irvine. And I would like to also pass it on to two of my other board members that are here with me today, Alexia and Zee.
Hi, my name is Zee. I am the current president of the Black Psychology Student Association. Thank you so much for having us here. We're super excited to answer all your questions.
Hi everyone, I'm Alexia. I'm the social media director for BPSA, and I'm also a UCI student who's a third year majoring in psychology. Thank you guys for having us.
Thank you, BPSA leaders. And now I'd like to introduce you to Ms. Kelita Gardner with Second Baptist Church.
Good morning, everyone. It is truly an honor to be in this space with you today. I'm the executive director of Second Baptist Church, as well as the anchor executive director of the H.E.A.L organization. That stands for Health Equity for African Americans League.
Thank you, Ms. Kelita. And so, yes, let's go ahead and jump right in. For BPSA, I just want you all, and I don't know if it's Adaeze or, Alexia or Zee, for you to tell us a little bit more about BPSA. What is the work that you all do, and what are your aims for the organization?
I'd love to talk about that. So as an organization, one of our main focuses is to grow the community of Black psychology students, trying to have more people in the Black mental health field. It's really important because we see so many people that are in need of these mental health services, especially in the Black community. But a lot of times someone wants to talk to someone that's like them. I would face a big feel is like the understanding if you have a Black therapist or a Black mental health provider, you can have that different sort of connection with them, and that's really, really important. And right now, us in school, we're the ones that can make that change to go into that field to have more providers. And we also like to provide resources on campus. We try to do a lot of the campus events to provide mental health resources to our fellow students.
Thank you. And so I actually do want to take a step back because I want to hear more from you, Zee, first about yourself, your major, and kind of some of your career aspirations.
Yeah, of course. So right now I am a third year psychological science student. I'm also minoring in Spanish. This is because a lot of my focus is to work in the Black and Latinx community. Um, my main focus right now is trying to do research in early ADHD and autism detection in the Black and Latinx community. A lot of this does come from personal experience. I got diagnosed almost pretty much right before I went to college, and it was really hard for me to transition and understand myself so late on. But a lot of times in their communities, people tend to be diagnosed a lot earlier, like when they're 3 to 7, which is when you actually get those accommodations. If you don't know, if you get diagnosed with ADHD after the age of 7, you actually don't get a lot of accommodations anymore. So it's really important for this early detection so that more Black and Latinx kids are able to get the needs, their needs met. So that's kind of where my focus and push is. Right now, I'm kind of looking to be an LMFT, so just a licensed therapist, and then moving on to get my PhD in clinical psychology later on.
Thank you, Zee, and thank you for sharing. Adaeze?
Yeah, like previously mentioned, I'm currently a third year psychology major. I want to actually go the medical school route. I aim to become a psychiatrist, and hopefully maybe a neuroradiologist. Um, One of the main reasons why I would become a psychiatrist is I feel like a lot of the times when it comes to kind of healing or kind of trying to figure out like a healing plan for certain mental health conditions, I feel like a lot of times like a psychologist or a psychiatrist mainly well, it is a psychiatrist's job to mainly focus on like the medication aspect of like mental diagnosis healing, but I want to kind of not necessarily change the whole field, but kind of be the type of psychiatrist that kind of focuses more on the non-prescription healing first before kind of going that route. Because I feel like because medication is something that's kind of pushed a lot in our society, that there's other ways that we can focus on healing mental illnesses and disorders first before going to the medication route. So, thank you.
Thank you. And Alexia?
Yeah, so as another student majoring in psychology, I plan to continue taking the route of being a clinical psychologist. With that in mind, I want to get my master's first in psychology and then forward that into my PhD program. And I'm currently doing more research on this when it comes to like marginalized communities in the psychological perspective, but this is mainly, along with Zee, kind of like a personal goal for me. I actually grew up in a country where any psychological resources was very, very, very limited. And as a result of that, growing up, I kind of more understood why people were acting the way that they were with this lack of like help. So as a psychology major, not only do I want to get my clinical psychology degree, but I want to stem that to specifically marginalized communities that do not get the help that they need. So yes, that's my goal. Thank you.
Thank you so much. And, these are future leaders in, Black psychology. So, appreciate you all for your interest and efforts. So now just open it up to all of you to kind of share more of the distinctive features of BPSA.
So with BPSA, some of the ways we kind of want to grow our club or see our club expand like in the future is we want to get more people involved in our club. We feel like the biggest kind of issue we currently have is member retention. And we want to be able to reach out and give like more people within our community more resources and open them up to different like opportunities, specifically like community service opportunities or just opportunities to get more involved in different like psychological fields or have more mental health opportunities. Yes. Is there anything you wanted to add, Zee?
Yeah, another focus that we have to be on towards, but definitely something we want to aim towards, is just spreading that the message and the mission of Black psychology to other groups. A lot of times we try to explain that Black psychology isn't just psychology for Black individuals. It's just psychology based in Black roots and more of that holistic healing. So it's something that everyone and anyone should be able to use. And I feel like that's a big barrier that we're trying to get over in terms of increasing our member retention. But we never want to forget about all the resources that we will and will continue to provide to the Black community specifically.
And thank you, Zee, for making that distinction, because some may say, like, why Black psychology or what is Black psychology? So making that distinction to say it's about the type of the practice features of psychology that are holistic in nature. And so, and it sounds like you all have a focus and, on your campus on kind of recruiting for more to be involved with, psychology and just supporting that clinical field and then offering support for students on campus. So how might a wider knowledge of Black psychology be a better therapeutic work for, or better therapeutic modality for other clinicians?
Well,
Go ahead, go ahead.
to stem from kind of what Zee was actually just explaining, and of course you guys can add along with this. I think for clinical psychologists today, I think it's really important to more understand that a person coming from a different culture does influence who they are. And it's really as simple as that for you to understand as a psychologist, because you want to not only give a direct diagnosis and treatment, but you want it to heal the person in a holistic way. And to do that, it's important to consider the Black psychologist perspective, because that allows you, as a psychologist, to tap into all areas and elements of what makes your client or your patient who they are, in order to more effectively heal them. Adaeze, Zee, did you want to add to that?
I apologize for the background noise, but to add on to that, our organization had a meeting a couple of days ago, kind of highlighting why we need more Black therapists. And a lot of what we focus on is talking about cultural competency when it comes to mental health professionals. And I feel like a big part of Black psychology is understanding psychology from um, different cultures, or taking account of different like people's different socioeconomic backgrounds and cultures and religions and etc. And our meeting touched on cultural competency. And like Alexia said, that mental health professionals, I feel like when they're going into treating a patient or talking with the patient, that they need to understand where the patient comes from, their socioeconomic background, their religious beliefs, because like Alexia said, it makes for a better more diagnosis plan and like a healing plan. Because I feel like if a mental health professional does not have cultural competency, it's very easy to underdiagnose or misdiagnose a patient.
Thank you. Thank you. And so, one of the big, issues is not only in the Black community, but it's a big issue in the Black community, is the stigma around mental health. So tell me some of the ways you all try to address this in on campus and in your work with the community.
Definitely. Whenever we hold any meeting, a lot of the times we do integrate these kind of deeper questions, ask people, like for example, when we did our meeting and we talked a lot about cultural competency, we asked them like, is there any experiences where you feel like you would need like a provider that is culturally competent, that understands your background and whatnot. And we make it very clear that our meetings are a safe space, because one of the biggest, like easiest ways that you can kind of fight that stigma against mental health is just talking about it, being honest with people, being vulnerable about your mental health, and to be real, because it's the hardest thing to be honest. Like when someone asks if you're okay, or it's normal to just say yes, I'm great, how are you, regardless of how you're actually feeling. So I think the biggest thing that we're doing to break that barrier is just opening the conversation. We also, we provide tons of resources to make sure that people understand that everyone has their struggles. You're not the only one, you're not alone. And I think that's definitely one of the ways that we're working on that.
Any other comments from BPSA leaders?
I can kind of just add some more of what we saw on the other side of the proof that there is stigma in in psychology for the Black community. In another one of our meetings, we were asking people to answer a little bit more vulnerable questions, because the main topic was shadow working, and we wanted them to kind of tap into mainly things that they don't admit to themselves or to others. And this was obviously a vulnerable activity, so they could have shared if they wanted to. But a lot of what I noticed from this particular community, this meeting, is that a lot of our members admitted to kind of just remembering being shut down growing up, whenever they would express sadness or crying or anything that was like an extensive expression of emotion that was kind of suppressed in their childhood. And I don't know if this is just the Black community. I think based on what I hear from my other like classmates and stuff, I would like to say that it's a well-rounded experience in marginalized communities. So, as BPSA, like Z said, we tap into these things that our members are admitting to, and we kind of like we want to raise awareness for that and continue to remember that as we become Black psychologists for Black people and for every person in the marginalized community.
Thank you. And so we know, especially related to this, especially around stigma, is the messaging, and it could be, supportive or detrimental to, addressing the stigma in the community around mental health. And so, can you all share with us, I should say, some of the ways that you all have, crafted messaging to address the stigma around mental health?
I can definitely start off. Um, this is, I think that one of the paths that we're definitely taking is also just talking about intergenerational trauma. I think it's really important that to address because this is a huge, huge thing in the Black community, and it's really hard to admit. It's really hard to talk about because there's a lot of ideas of respect and like what you should and should not talk about in a family with your parents, your grandparents. But it's important to talk about intergenerational trauma because it's been passed down for years and years and years. And a lot of this we talk about, um, there are a lot of the traces from slavery, because in general we have a stress diathesis model in psychology. So pretty much there's a level of stress, there's a little level of diathesis, which is your predisposition to have any sort of mental illness. So that diathesis we have, and a lot of marginalized groups have from, colonization and all of these things that have happened throughout history. And those kind of stress genes or anxiety genes, depression genes are passed down for years and years and years. And then added on to all of the stress of all of the things that minorities have struggled for their rights, feeling like a human being in the world, that adds on top of it. So minorities are more likely to have mental health issues just due to that model. And so to kind of like stop that train, you have to talk about it. You have to talk about, how your parents were raised and the way they treated you, because the way they were raised and the way their parents raised them. And, if there's any issues that are very much within the family, especially, it's important to bring up that conversation. But how do we do that in a respectful way? How do we have that conversation with, from my personal experience, my mom doesn't love the fact that I study psychology. She doesn't exactly, believe in it too much. But I try to have that conversation with my mom. And, we definitely have had a stronger connection because brought up all these topics about my childhood. We talked about her childhood, and I'm very much like in so much of a better place with, my family because I brought up these topics. Um, so, it's just an important thing. I think that this is definitely a message we try to spread through every single meeting we have is to address this issue of, intergenerational trauma. But with that, I wanted to say that I am going to have to leave a bit early. I have to go to my job. So thank you so much for having us here. I know Adaeze and Alexia will wonderfully answer all of you guys' questions, but yeah, thank you so much for having us here.
Thank you for joining, Z.
Yeah, thank you so much, Zee, and thanks for your leadership and the work that you all are doing on campus and in the community. We look forward to working with you.
Yeah, of course. Have a wonderful day, everyone.
You too. So I'm glad that Z brought up, the diathesis stress model, and I want to kind of hear more from, the BPSA team about the Black stress cycle. Tell us more and share more about that.
So, like Zee previously mentioned, the Black stress cycle and how it relates to that, the stress model is that, like she was explaining through generations of kind of like stress, anxiety, and depression, different disorders kind of being ignored or kind of swept under the rug and being passed down from child to child to child. It kind of creates this cycle of kind of like stress in a way, and it kind of pours into that diathesis stress model because these kind of like disorders and kind of issues are piling up through different generations.
Thank you. And so in terms of, again, the messaging around stigma and also to address, the generational trauma, could you share more about what you all have done in this space? Like in your social media and things like that, and your messaging around these issues?
Well, I think the main thing that we try to do is to target it head on by the topics we choose for our different meetings. Because we have a seminar type of setting, the topic that we choose lets us and our members know that this is what we're discussing, but this is also what we're cultivating as a space for you to come in already with the mindset that, oh, this is what we're discussing. And if I have stories or a past experience on this, this is a space where I can share that. And that kind of just taps into all types of topics, such as something general like the psychological struggles of women. This raises awareness for obviously mental health for Black women specifically, or women of every marginalized community, but it also lets our members feel open to maybe talk about their siblings, like sisters, moms, their relationships with them. Um, because tapping into the psychological struggles of women kind of lets you think about your relationships with women as a woman. And that lets you realize what, if it's healthy, if it's effective, how have you been communicating with other women? How do you see yourself as a woman? And that taps into how we were raised with the perspective of our responsibilities and our duties and the image we're supposed to have as a Black woman. I don't know if Adaeze, you want to like tap into this meeting topic or
Mhm.
anyone?
So we also talked about like Alexia was saying, we had a meeting on the psychological struggles of Black women and the psychological struggles of Black men, and invited kind of like men and women to come into our space for different each topic respectively, to kind of talk about kind of see different perspectives of like the conversation. So for the psychological struggles of Black women, as Alexia was saying, is we invited people into the space to talk about kind of like what they saw growing up, how they were expected to act or treat other people as a Black woman, and kind of like some of the stigmas attached to that, and kind of also unlearning some like unhealthy behaviors or ways that we are supposed to act as Black women. Also, for the psychological struggles of Black men, it was the same concept, inviting both groups to the meeting to talk about some of like the stigmas surrounding being a Black man, and also touching on like mental health and how that's stigmatized more as a Black man in the Black community. And those are just some of the things that we kind of when we're advertising it on social media, we make sure like people like understand, like when we kind of like post these meeting topics, that it's gonna get pretty like deep because we're gonna be like diving into like talking about these things. But we also have pretty like laid back meetings as well. Last, I believe, our fall quarter, we had kind of a series called Be Yourself with BPSA, where instead of a kind of like our seminar meeting styles, we kind of like alternated. So Be Yourself with BPSA was more so not like deep discussions, but more like wellness activities like yoga, vision boarding, shadow working, and stuff like that. Just to get people to also not only not always talk about like the deep stuff, but
Give it a little balance. Yes. So, and thank you for sharing. You all seem like you're doing a lot of work in your seminars and as a student group. I'm like, I want to join you. I've invited, like, can we come do a field trip? But so do you all have like for those because we understand that there is a small number of Black folks in Orange County, and so it's highly likely that a Black person will have a therapist that's not Black, or a mental health clinician that's not Black. And so for those that are providing mental health services or messaging to the Black community and they're serving the Black community, do you have any recommendations in terms of how they could either message to the community to show that they want to support and they want to work with them, or any recommendations in terms of how they can offer services to the Black community?
that is a really good question. I would say one of the ways I think non-Black mental health professionals can service or reach out to the Black community is by I know that when we had our last meeting, that was actually kind of one of like the questions that we asked people. Um, how, and then I remember one of the answers from our members was um, they had a therapist who I believe was not Black that kind of I'd say advertise themselves. I don't know if that makes sense, but kind of like on social media, they would kind of like make little like reels kind of saying that like they provide this service or they kind of like do this. And I think in order to reach like the Black community, I think it would kind of knowing that there is like a safe space for us to like relate to, because I feel like at least for me personally in Orange County it's kind of a little bit difficult to find a Black therapist, and if like and there's nothing wrong with that, and I feel like I going into a space like a therapist space, I want to feel like kind of like I can relate to the therapist, even if they aren't Black, if they understand kind of where I'm coming from, my background, and it is able to listen to my story effectively. I think that would be the most beneficial way to reach out to the community. Also, being like culturally competent of kind of like our background and where we come from.
Thank you.
Yeah, I was just gonna add to that in terms of maybe different perspectives to keep in mind as a psychologist helping the Black community in Orange County. I think it's like Adaeze said with cultural competency, I think it's firstly important to recognize that the culture in Orange County is different from a lot of what we may have come from. And also for the statistic of Black people to be so low, I think that's evident in the fact that it's low because a lot of us were never here in the first place. So to recognize that is to be like, okay, this Black patient that I have is possibly coming from a background, and that might cause them to have just shocks about their environment in general. So that's something to definitely tap into as someone who's trying to help them out. Another thing to remember about just the Black community or marginalized communities is that we are a very collectivist group of people. So to elaborate on that, what it means is we are very connected to our family, our parents, our grandparents, our just people in general. And what it is, and the variance of that is that Orange County is a very individualistic community. So what that means is for you to help a patient out who comes from this very close-knit community, you first need to recognize that now it's a possibility that the sense of independence might be a little bit more of like an adaptation, or it definitely varies from where they come from or what they're used to. And all of these things just tie into like what me and Adaeze and Zee have been explaining this entire meeting is that you as a psychologist helping marginalized communities, your goal should always be to help them heal in a holistic way. And that obviously includes recognizing and adapting towards their cultural background in the way that you approach helping them.
Thank you, Alexia. A good way to wrap it up. And before I move on to Ms. Kelita, is there anything else? Because I mean, I feel like, you know, you gave that kind of closing comment about really just understanding as a clinician serving the Black community, the ways that you can serve them best is just by looking at it holistically and kind of understanding the perspective of the other person that you're serving, whether you're Black or any, you know, minority group. So anything else you'd like to share with folks in terms of how they can, you know, support Black psychology and or support Black folks on their journey to mental health, improve mental health?
I think one of the ways is coming into our communities as well. I feel like I forgot the saying, but basically, if you want to make someone not necessarily trust, but feel like they can come to you for help, I feel like the most important thing is coming into their community, getting to know their culture. And but before we move on to Ms. Kelita, I wanted to advertise that BPSA is having our upcoming summit this May 25th. It is our Bridging the Gap Summit of Inclusive Career Opportunities and Mental Health Resources in Psychology. This summit, we're going to be providing kind of a career-based resources to psychology, psychological sciences, and cognitive science students by kind of hosting a panel with guest panelists from different groups and backgrounds and field of psychology. And they're providing resources for marginalized groups and kind of having organizations boothing to give students access to mental health resources on campus and outside of campus. And we're also going to be educating in the gap in mental health care, where people will help people understand the barriers, stigma, and socioeconomic factors that come with accessing mental health care, and also kind of teaching more people about Black psychology. So that's going to be on May 25th at the UCI Student Center. Thank you.
Thanks for sharing about that event. Do you all have a flyer or anything that you can share in the chat?
Yes. Oh, go ahead, Alexia. Go ahead.
Yeah, I was just going to say that we can definitely share that with you guys, but we will also be posting it on our page on Sunday at bpsa.uci on Instagram. If you guys want to give it a follow, I'll also put our @ in the chat so you guys can support Black psychology. Thank you.
Thank you, thank you, thank you. And again, thank you for your work. And yes, if anyone can attend, I know, you know, we will be there. SLC will be there. Now, if we want to table, is there a certain registration process or anything? Should we just contact you through, or should we just contact you through social media?
Yes, please. You can send us a DM on our Instagram if you're interested in boothing. I believe we have I believe 2 more spaces for boothing. So please, anyone is free to booth. We would love to have as many resources as we can.
Thank you. So get it while it's hot. Only a couple spots. So yes, we would love to support that. And so if you can, please do so. So next, I'd like to, and I will come back to you, BPSLS at the BPSA, sorry, at the end to kind of have closing remarks, but I want to move on to Ms. Kelita to share a little bit about herself and the work that's being done at Second Baptist Church surrounding mental health for the Black community. Ms. Kelita?
Well, first of all, I just want to say that second booth is taken. H.E.A.L would love to be a part of that event. So sorry for anyone else who was planning on coming, but I'm Kelita Gardner, and I'm the executive director at Second Baptist Church, which is the oldest Black church in Orange County. We just celebrated 100 years last year. We are fully committed to having a positive impact on our community. When SBC was founded in Orange County, Jim Crow laws were real, and Black people were not allowed to worship with white people. So Second Baptist Church went to First Baptist Church and asked for some support. And they actually did give us our first set of Bibles, pulpit, and a stipend to help us to get on our feet. Interestingly, about 5 years ago, First Baptist Church closed their doors. They aged out. And one of the things that they did was recognizing the work that we were doing in the community, they gave us an endowment of over $2 million, which is given to help us to help advance the cause of the ministry. So as you could imagine, Second Baptist has some deep roots in the Orange County community. We are a trusted voice in the Black community. And we are led by Ivan Pitts, who is a phenomenal speaker and is really driven to support changes in the community. What do I mean by that? We have various initiatives such as working with the sheriff's departments. Every month he has a lunch that lasts about 4 hours, talking about leading with love, helping them to understand when they encounter the Black community, what are some of the things that we think about when we are approached by the sheriff's department, and trying to build bridges there. We also host key leaders. Senator Warnock was here for our anniversary. We had just had Barbara Lee here, not as political officials, but as leaders in mental health and wellness. And then Cornell West, who is a huge advocate of leading with love, truth, and justice. So those are some of the areas that we've been focusing on at Second Baptist Church. I think you asked about my role. So as executive director of operations, I basically manage the business side of the church. So anything you think of in terms of running a business, facilities, payables, et cetera, that falls into our team's area of responsibility. But recently, the pastor gave me the additional task of working in outreach, working with other organizations to advance justice as well as mercy and equity. And I'll stop there.
Well, no, I want you to keep going because that brings you to your additional role as the project director of H.E.A.L. You had mentioned it earlier, but tell us more about your role with H.E.A.L and what H.E.A.L is.
My pleasure. So H.E.A.L stands for Health Equity for African Americans League, and it was born out of a focus of serving our community. During the pandemic, as you know, there was a lot of misinformation being given to the Black community around vaccinations and COVID. And our pastor, as well as 4 other pastors, really felt a burden to serve the Black community in this crisis. As you know, we have quite a few more comorbidities that resulted in terrible outcomes if someone contracted COVID, but there's also a lack of trust based on the Tuskegee Institute and Henrietta Lacks experiments, et cetera, with the healthcare industry really doing a disservice to Blacks. So we ventured into the area of educating the community on vaccines and COVID. We worked with the healthcare agency to coordinate vaccination clinics at our church, as well as another church, New Hope, which is part of the H.E.A.L collective. These 5 pastors decided that there was no need for us to compete. We need to collaborate as much as possible for the benefit of the community. And because we were so blessed to be able to help over 1,700 families with getting vaccines, we were approached by the H.E.A.L, the healthcare agency, to see if we would be willing to do work around health equity in the Black community. And actually, that's how I met Mr. T, who was working with the healthcare agency at that time. And so as we started working in the equity space under a grant from the CDC, we found that there was a need for data in the Black community. Unfortunately, the healthcare agency didn't have very much data on us because we don't like giving our information to governmental officials. I'm not telling you all anything new, but we were able to use some really good practices around developing a survey, benchmarking a community needs assessment with Advanced OC. And we created the first statistically significant survey around health equity for the Black community. And that was analyzed by the Black community and able to share that information with the county. So we're very proud about that.
Thank you, thank you, thank you. And I'll just say more about, that is where when we were introduced to each other through our, work during the pandemic, and then of course supporting with, the H.E.A.L collective. And so I'll say that just from the Advanced OC side, we just saw the opportunity to flip the paradigm in terms of we understood that most times when we went to government agencies, they would say, we don't have data on the Blacks, so we don't know what to do because we don't have data. But there was no resources or, put forward to actually find out how we could, gather that information. And we know that, folks were engaged, but we just wanted to figure out how we could best support that effort. And I'm, thankful for Second Baptist and all the churches that were part of that effort, and for it to be significant and those results. Let's talk more about the results of the survey, because that's the important part, is what do we do with the knowledge now that we know the needs of the community based on their feedback? What do we do with that?
Yeah, that's a really good question. I want to piggyback just a little bit on what you just said, though. Oftentimes when we were working with the healthcare agency and other entities that were focusing on the pandemic and recovery, it was interesting. They didn't know where to go to reach Black people. Unfortunately, the Black community in Orange County, and I think Alexia said it best, it's different here. We are not in one zip code. We found that there are Blacks all over Orange County. And fortunately for us, our churches are strategically placed both in North, Central, and South and Eastern Orange County. So we reach a pretty broad spectrum of the Black community. What we found when we did our survey was there were 4 key areas that are really impacting the social determinants of health when it comes to Black people. The first one is mental health. We saw a huge response around people desiring to get mental health services, unable to identify Black therapists and culturally sensitive mental health therapists. The second pillar that we found was access to affordable health care as well as nutrition. There's a lot of food deserts around here in our communities where we're living. Affordable housing, and then discrimination in healthcare. Many of you are very much aware of the maternal health issues that are happening with Black women. It's very prominent in Orange County as well. But we even had people who provided us in focus groups feedback around doctors who refused to touch them. And we're talking about this decade. We're not talking about 20 years ago. Doctors who would hear their list of concerns and complaints and respond with either under-medicating or over-medicating their patients, or just dismissing all of those issues and saying, oh, it's because you're overweight. So when we found these issues to be so prevalent in our community, we could not turn our back. We had to share the results of our survey with the community to build trust, but also to advocate with our local and state and elected officials, as well as our healthcare decision makers, to let them know we will not tolerate this any longer.
Thank you. And I'll, just say that based on those results, especially with mental health being the top, priority, that was highlighted through the survey results, again, Advanced OC and myself specifically, I thought, how can I take action to address this issue? And so that was the catalyst for starting Main Expressions, because, in Orange County, I actually am from LA, but started my career in Orange County and kind of have been in Orange County for the last 16 years. And so my experience in Orange County is exactly what Ms. Kelita just said. I mean, we're all over. When going to Cal State Fullerton undergrad, I felt like that was the most Black people I'd ever seen on the college campus outside of the Black church, and so I thought, okay, if mental health is still continues to be a top priority for our community and it's a need, then how do I address it? And I said, maybe through barbershops and salons. I know that we also are, going to these providers, for services, and we know that those providers are also trusted sources in the community to have conversations. I mean, if we think about history, it would be, political fairs and things like that in the barbershops and salons. And so let's have these courageous conversations around mental health and reduce the stigma around mental health, in these spaces. And so we launched Main Expressions, and it's a self-care series. Even the framing of the program was self-care as opposed to a mental health program, because we knew that would turn folks off as well. And so what we've done with Main Expressions and in collaboration with H.E.A.L is, really hosting these workshops virtually and on site at barbershops and salons. And we've included all personal care professionals. So we've had estheticians, we've had permanent makeup artists, we've had, everyone across the spectrum on that, in terms of how do we support each other, and then have these conversations around mental health. And we've been doing that for the last 5 months, and it's been powerful discussions, where folks are saying, we were looking for this, and we need this. Sometimes those experiences that we have, like Ms. Kelita said, at the doctor's office, we don't have anyone to talk to about it. We don't have an outlet. The microaggressions the racism that we experience in Orange County continuously, how do we process that? And for men, especially Black men, when we are depressed or anxious about things, it comes out as anger. And that's not something we can express. We want to be able to express it in a healthy way, but if we don't have an outlet to, express that, then, it's not a good turnout. So just happy to be a part of the process of helping, the Black community come together to have these conversations and to just start having the conversations about, how we can improve our mental health and just come together as a community. So outside of H.E.A.L, I know that SBC is also running other programs, and so I know about the CARE peer coaching program. I also know that there's, a Living Water, wellness center coming from SBC. So Ms. Kelita, tell us more about all the other things that SBC is doing to really support with the holistic. I mean, we heard this from, BPSA, the holistic approach to supporting folks on their wellness journey.
Yeah, it's really interesting how this is all coming together. So about 2 years ago, our pastor, Ivan Pitts, you can Google his name, was attacked outside of his home, stabbed 7 times by someone who's suffering from mental illness. And it was really devastating for us, but he survived and he's thriving. Yes, we are so grateful for that. Great sense of humor. You should definitely check us out on YouTube if you want to hear him speak. But we were approached by the county to participate in a grant on wellness in diverse communities. The county really wanted to serve those underserved communities in an authentic way. And so we launched a program to help our leaders and any community members who are oftentimes trusted and approached by people who are dealing with some issues and need someone to kind of walk alongside them to help them to manage their mental challenges. These are peer coaches. And if you are familiar with the Black church, oftentimes people will come to pray, but then as you unpack that prayer, they need a little bit more support than just a prayer on that given day. So our peer coaches have been trained on various topics of substance abuse and trauma. We've been educated by Dr. Jackie Mack Harris. I don't know if any of you know who she is, but she has taught us that trauma that is not transformed gets transmitted. So you need to address that trauma at the root of it.
Could you please say it again? Sorry, I'm sorry to cut you off. Please say it again.
Okay. Trauma that is not transformed gets transmitted. And I think someone was talking about intergenerational trauma. That's what we're referring to there. Unfortunately, we see the effects of that transmission in various generations, even in the church. But we also believe in a Zulu word called Ubuntu, which means humanity. I am because you are. We translate it as if I'm okay, if you're okay. So we really take to heart the need to address mental health, destigmatize mental health, and encourage people to get additional support if needed. Then after our survey came out, the pastor said, oh, we've got to do even more for the community. So we launched our campaign to build a wellness center on our campus. We currently have a 1-story building that we're looking to renovate and provide initially mental health services to the community, but also we're looking at holistic emotional health, so yoga, whole food plant-based nutrition, physical health, as well as financial health, because we know in the Black community, financial health or the lack thereof could have a significant impact on your psyche and your ability to thrive. So coupling that with H.E.A.L, we're very much committed to transforming. And as one of the attendees here, we really do want to thrive in OC.
Absolutely. So thank you so much. I mean, SBC is busy, Ms. Kelita is busy, running these programs and supporting the community. And I'm glad to be a supporter and, along the journey. But how can other service providers that are here on the call support, and become partners in this meaningful work with H.E.A.L or SBC and just overall in the work to support the Black community?
Well, I really appreciate this question. Initially, when I heard the question or read the question, I thought, speak up. When you see injustices, when you see somebody needs some help, speak up, show up for them. But you all are already doing that. I think H.E.A.L, being church members who have not worked in this space, we're not a group of Black psychologists. We certainly could use some leadership and support in terms of helping us to identify various modalities to help our community. We have a website, healoc.org. Feel free to also follow us on Instagram and Facebook. Tag us. I'd love to get some posts from you all to post it on our website around mental health, the Sojourner syndrome, which is something that Black women suffer from. You all talked a little bit about the suffering of Black women. We'd love to hear more about that and lean in on that. We are also desiring to be a hub of resources for the Black community. Oftentimes, because we're so spread out, it's hard to find Black mental health care professionals, and to hear the voices of Black mental health care professionals who are helping us to even frame up the conversation when we are talking to someone who's not culturally sensitive, to help them to understand what we need and to better serve us. So I'd love to partner with you all. This Sunday, if you are so inclined, you're welcome to join us at Second Baptist Church. We are having part one of a two-part series on mental health care. We are having a psychologist come and talk about mental health care with the pastor. And we also are on YouTube. But on the 5th of May, we are hosting a mental health fair with mental health care providers. Advance OC will be here. What we're really looking to do is, again, destigmatize mental health and make it more accessible to Black people so that they are able to address some of those deep-rooted issues like you were talking about from childhood that perhaps we aren't even aware is impacting us today.
Well, thank you, Ms. Kelita, for your.
Sorry to interject. A quick question, Ms. Kelita, when was that the mental health fair you mentioned?
Cinco de Mayo, May 5th.
Got it.
And we will have tacos.
I think it's 10 a.m., right?
Yeah, it's immediately following our service. So it's between 10:15, 10:30.
Okay.
Yes.
Yes, I will be there and will love the tacos.
And I'll share
well,
the flyer with David after the call.
Perfect. So, David, I don't know if we want to open it up for questions from, attendees, before we kind of get to closing remarks from the panelists.
Yeah, any questions from our audience, from attendees? Any comments or anything like that?
I know David always has a good question, so I know he's thinking.
You got a lot of them, Mr. T. I think that, yeah, I think while folks are thinking about it, I'll just add, a quick comment. I'm so grateful for you all to join today. I think there is so many. This is one of the fundamental things that we focus on, Connect-OC. One of the things that we kind of inadvertently highlight is part of our work. Our job, Connect-OC, is primarily focused on promoting existing mental health resources, because one of the major areas of gaps in services is simply folks not knowing about what's out there, right? And it would be a mistake to say that there's a glut of mental health resources focused on the Black community here in Orange County. There really isn't, right? But there's a lot of really good stuff that is happening and things that are emerging. And so I'm really excited to have you all speak to that. I'm excited to hear both from the Black Psychology Student Association members, and to see not only, we've talked about this, but the approach is so innovative. It's not simply an organization for Black students focused on psychology or for Black students seeking mental health services. It is that, but it's promoting this really distinctive approach to psychology that is not only so beneficial for the Black community, but frankly, beneficial for anyone who has access to it. Anyone from whom encounters a clinician or encounters in their own research the deep roots and resources that come from a Black approach to psychology. And you know, and then Ms. Kelita, what you all are doing at SPC, what you've been doing for a long time, but seeing the ways that that's beginning to culminate in the upcoming Living Waters Resource Center, right? And the work that you all doing developing care and just the fact that you are highlighting the topic, frankly, more than most faith communities do, right? Faith communities inevitably deal with folks' mental health challenges because folks come and they say, you know, Pastor, I'd like a prayer, but when you dig deeper, like you said, there's so much more beneath it. But seeing the ways that you all are marshaling the resources that are out there and doing really work in your community and for your community is not only amazing, but should be an inspiration to all communities here in Orange County, to all faith communities. So I'm just grateful to have you all join us. I'm grateful for the work you're all doing and for folks to hear a little bit more about it.
Thanks, David. Any questions from anyone?
Thanks, David. I actually don't have a question, but I do want to extend an invitation. The Living Waters Wellness Center is still in the planning stages, but if any of you would like to help us with development of, you know, what that program would look like, how we could optimize the services we plan to provide, and then obviously, once the center is built, we would love to have you all come in and provide services and use this place as a resource for you to be able to practice.
Yes, make sure you guys contact Ms. Kelita for that.
Yes.
Okay. There's no questions. You know, I'll go back to BPSA for you all to give any final closing remarks, words of encouragement for folks, in ways that they can continue to support the Black community in Orange County.
I personally don't have too much else to say, just that our club, we definitely want to give our members more opportunities to kind of have volunteering or just like any type of opportunities with the county in mental health or any like psychology careers to kind of like spread our message and get involved. So yeah. Alexia, did you have anything to add?
No, that kind of summarizes it for our organization. Our DMs in Instagram and our email is always open for us to spread awareness about what you guys are working on in our county, but also for our other members to get opportunities and access to all of these great things, just to get involved and to build their resume. Because our goal is to not only spread Black psychology, but also help all of our members get to the point they want to be at educationally, academically, work-wise. And for encouragement, I would just say to continue encouraging Black psychologists. We have less than 12% of Black health professionals in America. So if you hear about any Black student in med school, in psychology, encourage them, pray for them. Yeah, and that's it. Thank you guys so much for having us.
Yes, thank you so much.
Ms. Kelita, any final words?
God bless y'all. We really, I just ask that God would put a blessing on each and every one of you for the work that you're doing. There's a huge chasm out there when it comes to support of Black people regarding our mental health, and for you to forge ahead with such excellence and authenticity, it not only warms my heart, but it blesses our community. So I thank you so much for all of the hours that you spend studying. I'm about to get emotional. All of the time that you take to really dig deep and not only address your own, perhaps previous issues that have existed, but also to share that with the community. We will thrive. We will thrive, definitely. You are, the work that you're doing is extremely encouraging. There were several times I wanted to just run around this room and shout because as a paraprofessional in this space, we didn't know that you all even existed in the work that you're doing. So just to have the knowledge of the BPSA is very encouraging. But more importantly, I look forward to the future that we will have together in collaboration and the work that is yet ahead of us, because there are a lot of people, over 70,000 Black people in Orange County who have been looking for you, who have been praying for you. So I thank you so much for allowing me to be in this space and to hear all of the wonderful things that you're doing.
Thank you
Ms.
so
Kelita.
much. That means so much.
I
I'm like,
sincerely mean it too.
it's true. Yeah, I'm actually, Miss Kelita took the words out of my mouth because I just wanted to start with, just saying I look forward to working with you all and continuing the work that you're doing. I mean, you are, like I said, our future leaders, and whatever ways we can support you, whatever way you can use your expertise in supporting us to build and develop things in Orange County is, we're here. And secondly, for Second Baptist Church to be have a legacy and be leaders for years in supporting the Black community, and especially around mental health, like David said. I mean, for me, this is where I get emotional because I've been, doing this work, and I feel like the only Black person kind of doing this work for so long. I mean, I was the only, therapist for every organization I worked for, only Black therapist or clinician, every organization I worked for in Orange County. So, I did feel like it was a lone star. And so to just know that the work is being done, at Second Baptist and it's being spread through all the churches, I'm just, again, happy to be a part of the ministry. I didn't say this earlier, but I just know my purpose, on this earth is to support others and turning their tragedies into triumph. And so, that's me. Whether I like it or not, that's my assignment. And yeah, I'm just, again, happy to do the work and to support, all the efforts that's being done to support the Black community in Orange County. Turn it back over to David.
Well, again, thank you all. And I'll just hop back onto the praise train for a minute and just say, I mentioned how amazing the work that the Black Psychology Student Association is doing, but I also want to join those who are highlighting Alexia, Adaeze, and for Zee, if she hears this later, that you all as future professionals, one, I mean, you're in your third year undergraduate work, and I'm hearing the kind of knowledge and wisdom and understanding and energy for the field and for this work that you all are expressing speaks so well of not only your future professionally, but the future of those who will benefit from learning from you and receiving services and encouragement and support from you. So this is really, it struck me, Mr. T, as you were talking just now, when you highlighted, the work that SBC has been doing. We're looking at a little bit at like the past and the future, right? SBC has been doing this kind of work in some way or another for 100 years. And now we're looking at, the future of the work that SBC is doing, the future of the work that you have been doing, right, Mr. T, and the innovative work that you all at Advanced OC are doing, but also the even further future of the work that the alum of the BPSA will be doing, that you all will be doing. And so this is really kind of it's a beautiful coming together of that. And I also want to highlight and praise for a moment, Mr. T, thank you for everything that you are doing, for as long as you have felt like you are the only person doing this work, that you have kept doing it. and found that energy, as difficult as that might be. And I'm grateful, especially that meant that we got to connect and to create this opportunity for you to step in here and lead this conversation so well, and to give space to talking through not only the story, but also all of the amazing things that are happening and beginning to happen here in Orange County for the Black community around mental health. And so thank you especially for being here. That being said, oh yeah, go ahead.
No, I was gonna say I actually have a everyone else had the events, and I'm like, okay, so if you all want to learn more about H.E.A.L, and also to experience one of the main expressions workshops, then we will have an event on May 11th at 10 a.m. The flyer is already in the chat, but just wanted to make that announcement for you to come kind of understand a little bit and more in depth about H.E.A.L and the work that's been done, and meet others that are a part of the churches and the committee. And again, to experience like kind of a self-care workshop with us. Please join us if you're available.
I plan to be there. So as we wrap up for today, just a couple things. We've got about 10 more minutes. I just want to draw your attention to a couple things. One, Crystal just posted in the chat the websites for Second Baptist Church, for Advance OC, and the Instagram account for BPSA, which is one of the best ways to connect with them. She also posted in there a link for a survey. As always, if you could take a couple minutes to fill out this survey, it's helpful to us, it's helpful to the county, it's helpful for us to demonstrate what about what we're doing is going well, and also where we can improve. And then Ms. Kelita just posted in as well into the chat the flyer for the Mental Health Resource Fair on the 5th, on Cinco de Mayo. I'll also share that out. That is there for you all. And then anything else? I'll open it up now for the last few minutes. We have any other updates for our attendees, any other events you all have coming up, or anything like that? Yeah, Kat.
Hi everyone, good morning. It's still morning, which is great. We still have a couple more minutes. So I'm Kat Reyes. I'm the Community Education Coordinator for Planned Parenthood of Orange and San Bernardino counties. And we actually have a free webinar coming up on May 15th to talk about male and male involvements, which entails combating toxic masculinity and encouraging male identifying folks to seek mental health services and to break unhealthy cycles. Again, this workshop is free, is for everyone in the community, especially folks who work with youth. I'll go ahead and put the flyer on the chat here, and I'll also send it to David to send out as a follow-up email with the rest of the flyers. But I just wanted to share this with everyone, especially since we are talking about mental health and in lieu of Mental Health Awareness Month next month. So thank you so much, everyone.
Thanks, Kat. Anybody else?
Here, I'm gonna hop in here. Hi everyone, I'm Amanda with NAMI Orange County. Next Sunday, we have a NAMI Talks event that we'll be hosting in downtown Santa Ana. It starts at 1:30. We've got 4 amazing speakers who are going to be sharing their mental health stories and just inspiring teens and young adults to, live a happy, joyful life and accept, maybe some of the hurdles that do come that way, but that they can make it through it and have, fulfilling lives. So we have 4 speakers that'll be talking, and then we have a panel discussion. So our audience can ask our panelists any questions that they have regarding mental health or what they listened in those talks. So I'll drop the flyer in the chat. So we hope to see everyone there.
Hey, thanks, Amanda. All right. Well, on that note, if there's nothing else from our attendees, again, thank you to all of our panelists for joining and for sharing your experience, your wisdom, and about the resources that you all are participating in and developing. And if there is anything I'm missing, please reach out, dpattison@p4w.org. We thank you all again for joining. We'll give you the gift of 6 minutes. So take care, everyone.
Thanks, David.
Thank you so much.
David, take care.
Bye,
Have a
everybody.
good weekend.